Hello, I'm Tim Leahy. I'm an infectious diseases doc and the director of ethics. And I wanted just to say a few things about caring for unvaccinated patients or patients who might have uncomfortable interactions with because of COVID skepticism. As you know, during the COVID pandemic, which now has killed well over a dozen million people, there's been a lot of political controversy about this thing that really should be about public health. This has ranged from people who aren't sure COVID is a real thing, yes, it is, to people who have skepticism or even anger about methods to control it, like vaccines or masks. And this sometimes can bleed into bedside clinical care. I've given a few examples here. The 44-year-old who's unvaccinated and needs treatment for pain, and the bedside clinician is worried about their own personal safety. Or the 77-year-old who won't wear a mask in the setting of less time-sensitive care, or the 23-year-old who thinks that COVID is a hoax and wants to talk about that at length while needing time-sensitive care like dialysis, or most concerningly, the 55-year-old who's upset about all things COVID amid getting care for mild pneumonia and threatens a nurse. How should we manage situations like these? I think it's really important to come back to the core principles that we all go to and keep close to our heart when we're providing good care. First and foremost, compassion, but also a need to connect with that person as a human being to provide excellent or actually the very best care possible, and to do it as a team, knowing that we and the patient are at the center of that team. And in that whole interaction, we really are balancing the thing we foreground the most frequently, which is patient-centered care, providing care that fits their preferences. But also, we should not forget that we have a right to live and exist in a safe work environment, and that there are limits to the amount that we'll bend over to accommodate patients. So in the middle of a pandemic with political controversy going on, of course, emotion is going to come up. And of course, we're going to do our best to be professional and kind. And let's say we're detected to have some emotions about something. I don't see that as a problem. We're not robots. But I think here are some tips to try to make things go more smoothly and to make sure we can look back with pride on how we comported ourselves. So one is just to avoid political topics during acute care. You know, if somebody wants to go off about how so-and-so some political figure managed COVID-19, that's something we can avoid. We can just say, you know what, we both agree on the fact we want you to feel better. Let's focus on that instead. And I've used that to avoid political controversy with patients. Another is to focus on that patient's humanity. You know, sure, we could view that person as an unvaccinated person or somebody who won't wear masks, but maybe also they're a lawyer who's worked for civil rights causes, or a grandmother who loves her kids, or an artist whose painting we admire. We can focus on that. That helps us feel better about the care. It helps them feel like we cared about them. And honestly, if we respect them and connect with them more, they're more likely to listen to our persuasion. We can provide care safely, even if patients don't understand the ins and outs of COVID. So our masks and other PPE really do help keep us safe. And so although we want patients to play by the rules, we shouldn't view it as a huge threat to us if they don't. But there are exceptions that I'll mention in a second. It's fine to articulate behavioral expectations. We don't want to go to conflict, and we try our best to avoid it, but that's not the same thing as us not articulating the rules. We can say that firmly and politely and then move along. What if that bridge building approach fails? I think it's important for us to remember that we want to save lives and reduce suffering no matter what, even if that person isn't somebody we would want to have over for dinner, even if they are misguided. But at the same time, we deserve to be safe, and I'll characterize where that line can be drawn. I think it's important to think of this as a spectrum. You know, the sicker the person is, the more acutely in need of help, the more we're going to tolerate behavior we wouldn't otherwise. Whereas if it's optional or not time-sensitive care, we can expect more from that person. And visitation is on that spectrum. We want visitors. It's good for our patients to have visitors. But if visitors won't play by the rules, then they may have to leave. So how to resolve those situations I brought up earlier. For the 44-year-old who's unvaccinated, I think we can remind ourselves that we're safe providing care of somebody who's unvaccinated if we're wearing the right PPE, so we can reduce their suffering safely, whether or not they're willing to get a vaccine 2 weeks ago. What about the 77-year-old who won't wear a mask in a clinical setting for not time-sensitive care? Well, those are the rules, and this isn't life-saving care. We could wait a little bit and they could come back maybe a day they're willing to play by the rules and get their cholesterol checked them. So this would be a case in which I would stick by the rules. What about the 23-year-old who really wants to talk about how COVID is a hoax, but needs something time sensitive like dialysis? I think we should provide the care and just avoid that topic. We don't need to convince every single person to do things the right way. The most concerning example I gave was the 55-year-old with pneumonia who's upset about all things COVID and threatened a nurse. That's unacceptable behavior. Sure, if somebody was dying right in that moment and a little violent, we'd probably just save their life, even if sedation was necessary. But if that person can safely go home, maybe it's not the most ideal care, but is unwilling just to be safe around us, that may be the consequence they experience. We should articulate the expectations, hope for them to behave better, but if they just won't, they may lose access to non-life saving care. So I hope that helps. And I did want to end with a thank you. The COVID pandemic has been incredibly trying for all of us in many ways. And yet, day after day, I come to work and I see the nurses, the doctors, the respiratory techs, the social workers, everybody being true heroes. You work hard, you're trying to save people, you're being patient, you're being the kind of humans we all should be. And I feel lucky to be around you. I know the quiet, reasonable members of our community understand this and feel deeply grateful. And so thank you from me, and let's hope for a better day coming around the corner soon.